Hello everybody and welcome back from your break. I'm delighted now to introduce Sara Benson. Sara Benson is the current Chief Executive Officer of Women's Aid Ireland, a national domestic violence support and advocacy organisation. We're delighted to have Sara here. We know that during the last 6 months of the pandemic that domestic abuse and domestic violence has been very high on the priority list, and we're aware that there's been increases in it. So we'd be delighted to hear from Sara and from the work that she does with Women's Aid. Thank you very much, Sara.
Thanks so much, Karen. And thank you to Linda and Emma and all of the organisers for inviting me to participate in your conference today. It's a real honour, not just because I see such strong potential connections from the work that Women's Aid does and the great work that you do, but also just on a personal note, just to say, as a mom of two who had the wonderful support of midwives in both births, I'm always awestruck by the amazing vocational work that you do to bring moms and babies safely through the journey of pregnancy and birth and afterwards. So really, really pleased to be here today. I have I thought that you might see me during the presentation, so I didn't write reams of notes because that's really difficult to keep the eye on the screen. But actually, I think you're just going to see my slides, and so I hope I do justice in terms of pacing myself through them. There's a few points I wanted to kind of go through today, but it will be very much a whistle stop looking at the issue of domestic violence and abuse. I'll say a little bit about what has been going on in the context of the current COVID situation, but obviously particularly relevant to your own work, say a little bit about some of the issues around domestic violence and abuse in the context of pregnancy and maternity, and some of the ideas, some of the good practice that's already happening there, some of what the research tells us, and then just some suggestions around ways that I really feel that I hope at the end of this conversation we'll be treating it very much as a jumping off point to continuing conversations. We in Women's Aid see that there's enormous scope for collaboration, and we may actually have some opportunities to try and harness that a little bit ourselves and drive it forward, something that we think is exciting and hopefully something that we'll be talking to you about again in the future as well. What I want to say up front is that the issue of domestic violence and abuse is a really difficult one. It is also a really prevalent issue, as you'll see in a moment, but that means that there is absolutely no doubt that there's going to be some among you, for whom this issue has touched personally. There may be some among you for whom it is an active issue in your lives, and so I'd ask you just to mind yourselves. I can't see who ducks in and out of the presentation. If you feel the need to step back or step back in again, please do so. And I will be sharing some details of support services, which may be referral points for others, but also likewise for anyone in the audience today, if any of this is affecting for you, I'd encourage you to kind of reach out and in a confidential way and just have a chat if that's something that you feel would be useful. I'm always mindful at the moment doing all of these talks that we don't have the benefit of that around the coffee table, a little bit of a debrief or a chat, or, and that's one of the nice things about coming together for, with like-minded people and peers, is that that isn't necessarily the case here. We might be all sitting in our sitting rooms. So, do mind yourselves. It is a difficult issue. Just want to acknowledge that up front. So I'm going to share my screen now, which I think means that I'm going to disappear and hopefully reappear a little bit later on, and again give some time, I hope, to a little bit of discussion or at least some questions and answers. So I'm hopeful that I've paced myself to allow for that as well. Okay, thanks. So I'm going to hope that the technology is working. Now, so I hope that you can see my screens there. So Sara Benson, that's me. And as I said, CEO with Women's Aid Ireland, acknowledging this is cross-border, and there are wonderful sisters doing great work in Women's Aid Northern Ireland and other organisations up the north who we'd have connections with as well. So a little bit about ourselves. Women's Aid have been around since 1974, so we're the oldest domestic violence organisation in the Republic of Ireland. We were the first, and indeed founded the first of the refuges back before there was laws or protections or anything. Some years ago, we actually divested ourselves of refuge in order to prioritise a combined approach to delivering frontline services, which includes the National Domestic Violence Helpline. That's a national free phone helpline. It's 24/7. And then we have one-to-one services in the Greater Dublin area. We have dedicated drop-in service in the largest family law court, and we do one-to-one outreaches and accompaniment. But the other pillar of our work is very much around public awareness, communications, social change effectively. And so that also includes policy and research and advocacy for the likes of legislative change, which we would have been very active in over recent years, including kind of probably most recently in relation to this issue, the Domestic Violence Act of 2018 ourselves, and of course others very active in improving the legislation in Ireland in that regard. Then we also have a training and development team as well, I'll say a little bit about later on. So effectively, we want all of our frontline work to inform those system gaps, social gaps, barriers to improving both prevention, but also support for those who suffer abuse, and then, of course, where necessary, the punishment of perpetrators, because we are, so often talking about criminal acts by one person against another. So. The term itself, domestic abuse, domestic violence, intimate partner violence, there's many different terms, but in terms of what do we mean by domestic violence and abuse, just to offer a definition which we've honed recently as part of a research project we've been engaged in with young people, 18 to 25s. And I've underlined the two key takeaways in the definition. So it's a pattern of abusive behaviour used by someone who is or has been or wishes to be in an intimate or dating relationship with another person to control that person. It can take a wide range of forms, including physical, emotional, sexual abuse, or the threat of same. So it may include physical violence, emotional abuse, coercion, destruction of property, isolation from friends, and so on, as noted here. I think what I want to say first and foremost is that this is different to what's sometimes referred to as situational couple conflict, which is where you have in some cases natural conflict that arises, in some cases persistent back and forth, where there isn't necessarily a hierarchy of power. So in domestic abuse, you do have a hierarchy of power where one person is exerting power in order to control that other person for their own, to have their own needs met. Predominantly. Also, it is not about a single incident. It is a pattern of behaviour. So it is, many small tactics, which, as I say, may, but also do not necessarily need to include physical or sexual violence. The threat may be sufficient, along with controlling behaviours. And I'll say a little bit more about that specifically in just a moment, because it is important and now importantly recognised in law that the coercive controlling behaviour is actually the playbook of a domestic abuser. So prevalence, we have 1 in 4 women in this country have experienced physical and or sexual abuse since the age of 15, which is a chilling figure. And in terms of, I mentioned the psychological abuse, which for many women who would contact our service actually refer to as the more impactful. I mean, I've worked frontline myself for over 20 years, and including managed the national helpline, and the amount of women who would say, I wish he would just hit me, because then people would believe me, then I could do something. And yet this is emotional torture. And the word torture is used frequently, and I don't use it lightly. But 1 in 3 women experience some form of psychological abuse in their relationship, in our relationship, I should say, over the course of their adult lives. Of course, there are also men who experience abuse. And there are members of the LGBTQ plus community who will also experience abuse. But this does remain very disproportionately a gendered issue. And a recent survey we've done with young people, which we haven't released actually the full results of yet, shows again that even among younger people, 18 to 25s and under 18s, the prevalence remains very, very high among women, much, much less among men. A very small sample responded. And in the male experience, 1/3 of those men had experienced abuse at the hands of a male partner as well. So I'm always very careful to say that, of course, not all men abuse, not all men are violent, not all men are destructive. I live with one. I like him quite a lot. It would be very difficult to do so if I believed otherwise. However, it is the reality in the world that the vast majority of abuse is perpetrated by men, and that includes against men. But when we are talking about gender-based violence, we have, the highest prevalence would be men abusing women. In terms of our own services and the level of response that we respond to in our work in 2019, that's just a snapshot of the responses that we did at a frontline basis. So 20,763 direct contacts between the helpline, which is 17,830, and then our one-to-one services, between our drop-in service in the court in Dublin, our one-to-one outreach clinics, court accompaniments, and then the casework calls, which is that ongoing support with women as they go through their journey. That is an increase on 2018. And I'll say a little bit more about what has been happening in the context of the COVID situation shortly as well. I'd also signpost the fact that our helpline, the National Free Phone Helpline, also refers to all of the local services around the country and acts as a direct connect service and referral to refuge. So those are our numbers. They also have their numbers. And when you add them all up, we really, really see the picture of the demand for services from women suffering in this country. I mentioned coercive control in particular. I'm pulling it out because there's a lot of talk about it, and then sometimes it seems like it's a new phrase in some ways. It is something that has been legislated for, and that's why I pull it out. Is this the first time in Irish law, and it's following on in other jurisdictions, including the UK in particular, where there's finally a recognition in law that a pattern of behaviour, when considered as a collective of behaviours, is actually a criminal offence. So you can have a lot of different tactics which in and of themselves, taken as standalone incidents, may not be crimes, but when you put together the whole picture, you see a very clear controlling pattern, a persistent pattern, which has the impact of isolating, minimising, wearing down, keeping in fear, and trapping women in relationships and making it really incredibly difficult to leave. So there is the definition there, which is taken from the legislation. And since 2018, it is against the law. It's actually an indictable offence. It's got up to 5 years imprisonment. It is a challenge for the justice system here because, as I say, there is such an embedded mindset is that, okay, well, it's one particular incident, one incident of physical violence, one incident of, damaging your car or, breaking something belonging to you. Those single incidents are the ones that tend to be prosecuted. So it's a challenge, and some cases are underway in the courts. One has successfully been taken, but our community awareness of this issue is really, really important to the success of it as a law, because we need to recognise that this is abuse. These patterns of behaviour, they are actually the abuse. That is the means by which control is maintained, that women are reduced to, where their every thought is actually filtered through how their abusive partner may respond to it. So really, it's actually referred to quite neatly, I think, as a freedom crime. It removes someone's capacity to act in a free and safe way. It's also really, really dangerous as well. It doesn't have to include physical violence, but as Evan Stark, who's a UK expert on this issue, says, not only is coercive control the most common context in which women are abused, it is also the most dangerous. And Women's Aid have had the rather grim but really important role of maintaining since 1996 the Femicide Watch in this country. It is the only archive of women who have died violently in this country. We track, we record the names of every single woman, and in some cases, tragically, their children also, who are killed violently in this country. And as I say, it is the only standalone record. And I'd also like to acknowledge that even in recent days, we have had a situation where, sadly, I fear, but I will be careful in saying so, that we will be adding to the report yet again for this year, for 2020. There'll be 3 more names, which I think is just an appalling indictment, in terms of how we can keep people safer. So in this country, 1 in 2 femicide victims is killed by a current or former partner. It is the most common cause of violent death of women in the world. It is different to the way that men experience violent death, in that for men, they are overwhelmingly more likely to be killed out in a public place or away from their homes, whereas women are overwhelmingly likely to be killed in their own home. And 82 women across the world killed by an intimate partner every single day. So a stark reminder of the stakes. And in some cases, we know from domestic homicide reviews in the United Kingdom, for example, is that there is no record of physical violence, but a very high level of coercive control. And the first act of physical violence is an act that causes death. So something really for us to be vigilant to. In terms of it, just because somebody isn't being physically hit does not mean they aren't in danger. I'll just say a little bit about the situation with COVID-19. I think that the minute we started realizing how serious this whole pandemic was turning out to be, which was in the second week in March, when we suddenly got news that the schools were going to close, I think all of us in the domestic violence sector, and I don't mean in Ireland, I mean all across the world, kind of took a big intake of breath and realized that the kinds of measures that were being called upon to put in place in order to try and reduce the spread of this new terrifying virus, to protect the most vulnerable in terms of our elders and those who had immunocompromised systems. Everything we heard, we realized this is going to make things very, very, very difficult, and indeed more dangerous for those who are suffering domestic violence, particularly in a cohabiting situation. Initially, we thought in Ireland, discussing with our colleagues, that we might see an initial drop-off. We actually expected we might see a drop-off in contact with our services, for the simple reason that women might not be able to actually make a phone call if somebody is 24/7 there, looking over your shoulder, listening at the door, or not even allowing you to close the door, following you through the house constantly, where those chances that you might have had to make a call, maybe dropping down to your mom's or your sister's, or from work, on your lunch break, walking the children to school, picking them up from school, all those opportunities for respite were suddenly collapsed and gone for many, many people. And so we thought, okay, we may suddenly hear a deafening and terrifying silence. So Women's Aid kind of upped the ante very, very quickly. We made a very concerted effort to start raising awareness that this was a risk, that the measures were creating an additional risk for those who were suffering domestic violence, that there needed to be community vigilance, that there needed to be awareness, for those suffering, that the services were still there, were still operating, that the helpline was still operating. And we were very grateful. We got free media. We got, in nearly every radio station ran an ad which just advertised the helpline. We got print media where we shared the helpline details, the details of Safe Ireland, and also the details of the guards. I mentioned male victims as well. We didn't forget them. We were collaborating with the Men's Development Network, who have the male advice line. So we all got together and just kept on pushing the message that we were there. that then resulted in the Department of Justice putting in place a campaign that they then resourced, which was, again, amplifying the fact that services and also the sexual violence services were there. So there was a big rallying around. And so we didn't see a drop off. Some services did initially, and then it started to climb up. But actually, the helpline never saw a drop off. Initially, it was kind of sustained. And then when we measured it from the end of March to the end of June, we actually responded to 43% more calls than we had in 2019. And as I mentioned, 2019, we were already responding to increased numbers of calls from the previous year as well. At the height of it, the Gardaí were responding to 25% more call outs. That is aggregate now at 18% in terms of from the end of March to last week, when they actually released updated information. And this was not just in Ireland. This global trend was, we saw it all across Europe, but we were hearing about it in China, the United States, all across the world. This was not unique to Ireland. I mentioned where people are cohabiting, but even when they are not, we are hearing of an increase of abuse using digital technology. So if someone's not living with their abuser, or it's a case where perhaps they are being abused by a former partner, the use of text messaging, social media, other forms of harassment to try and keep at somebody, that has happened. And a little bit worrying, not a little bit, very worrying for younger people as well, perhaps increases in what we call image-based sexual abuse, erroneously sometimes referred to as revenge porn, but increased kind of pushing of boundaries, requesting sexualized material, things like that, and then perhaps using it without her permission, sharing it, breaching her confidentiality, undermining her dignity. There was also an increase in emergency applications for protection, and the courts did remain open, and do now, even under our current level 5, remain open for emergency orders. And they did, on appeal from services like ourselves and others, also extend hearings for breaches of access orders and also breaches of maintenance orders, which obviously had an impact on those who would face poverty, where maintenance was suddenly withdrawn, as happened for a lot of women. So, we refer to it as the shadow pandemic. It was already there, and COVID has not really made it easier. But we all remain in solidarity, and we all keep going and keep that message out there that the services are still there to respond, and that communities should be vigilant as well to their neighbours. In terms of responding, I'm going to move now to say a little bit more specifically about the prevalence of domestic abuse during pregnancy, and some of the learning from some of the research that's out there, and some of the kind of good practice responses, which are not unique to a maternity setting, but just in general. But I think it's always worth pausing to note that even if somebody is trying to get out of an abusive situation, it is not a simple proposition. And that is particularly the case if somebody shares children with their abuser. The children are the tie that binds, and they bind forever. So I don't mean you, one may think, okay, just getting somebody out of the relationship is, that's it, problem solved. No, unfortunately, the abuse often will continue beyond, because the person who is abusing does not want to lose the power and control they have. They want to maintain it. And so they will make great efforts. And if somebody is going through the legal system, these are just some of the different examples of multiple proceedings that can be going on, often delayed. At the moment, a lot of hearings are being delayed. Abuses can still continue. And custody and access is a battleground where there is domestic abuse dynamic. And so I say that just up front, because it's just to recognise that the journey a woman may be on is not a simple one. The stakes are very, very high, and that can influence whether somebody feels that they may simply just try and weather it, which is not necessarily a good tactic, but one can understand when one sees something like this little slide here, just the overwhelming just the overwhelm of trying to navigate exiting an abusive relationship can actually inhibit somebody. And so that's where support, encouragement, and a joined up pathway of support, because we can't all cover everything, but that idea of creating a pathway, a connective route to support a woman to navigate what can be a really, really difficult, protracted, long-term process. is really, really important. And as I say, particularly where there are children involved, and for your work, that obviously is entirely apropos. So in terms of domestic abuse, it's one of those things that it's absolutely horrifying, but unfortunately, pregnancy not only doesn't offer protection to domestic violence abuse, it is actually identified as a high risk period where, in fact, domestic abuse can often begin or certainly will escalate and intensify. And there's a number of kind of considerations as to why that might be. One is that there is a move away in terms of the dynamic of the needs of the abusive partner being the entire center of the focus for the relationship, so his needs no longer being the number one priority. So attention being drawn, a third party entering the family equation. That might be one component. That's a little bit psychological, but the other is that there's a material issue where when one is pregnant, you're starting to access other services and you're out in the world a little bit more. So if there is a tactic to isolate and normalize abusive behavior when somebody is starting to engage with the health profession, there are opportunities for both those health professionals to see what is going on and also to offer intervention. And that is often the reason why the abuse escalates, because it is to keep her from disclosing. So international research there, as it says, found that 30% of women who experience domestic violence are physically assaulted for the first time during pregnancy. Again, just to acknowledge it's a very jarring thing to say, but it is also a fact that very often that physical abuse is very targeted and it will target the woman's abdomen. And so it is also the fetus that is being targeted as well, frequently in the context of that. And we have heard some very troubling reports ourselves to our helpline, where women have been beaten during pregnancy, where they have been, pushed downstairs, and where that has resulted in trauma and even death. For the fetus, for the unborn baby, and also obviously for her as well. So this is the final point there is based on a study that was done. Now, I acknowledge it was done a long time ago, and we'd be hopeful that perhaps there might be scope to do something more up to date. But at that time, the Rotunda conducted research and found that 1 in 8 women surveyed were being abused during their current pregnancy. I think that, in fact, that may be a little bit higher, but the difficulty is actually having a good, robust piece of research for this jurisdiction, which could just capture that. But either way, 1 in 8 is at such a what's supposed to be such a joyful time is quite hard to hear. I won't dwell on this, I think, but it is just around noting that domestic violence is slowly, but it is being acknowledged as one of the most serious threats to a pregnancy for a woman's health and that of the unborn baby, in terms of risk factors for the reasons I've already outlined there. And this is where we kind of move into the proposition around routine inquiry, which I know many of you will practice, but I think it's also worth looking at, are there opportunities here to think about ways to embed that system in a more effective way? Are there ways that we can collaborate together to support better outcomes, recognizing, going back to that slide that I was showing with all of the little jigsaw pieces, that there's one thing asking the question, there's what happens in terms of the answer, and and are we prepared if the answer is yes, what happens next? So considering that in terms of enhancing safety and support in a maternity setting, I just jotted out, these are a few signs for midwives in particular to have a look at. That's pulled from, I can share the slides, but also the references after if people are interested. You may already be familiar, but simple things like frequently missed antenatal appointments, late presentation for antenatal care is a particular red flag for domestic abuse. Injuries that are not consistent with accidental causes, anxiousness or depression, and a dominant partner. And that could be somebody who is, appears, just that little bit too solicitous, so not dominant in an aggressive way, although you will see that, and I have spoken with health practitioners who've even spoken about the partner literally sitting on the woman, also like sitting on the bed, but sitting on her, so she literally can't move. But you can also have somebody who's extremely over solicitous and in doing so will not leave her side for one moment. So there's ways of being dominant. And as I mentioned before, abuse victims may have difficulty using antenatal care services, as the perpetrator may actively try and prevent her from attending appointments. And if they do, they will be there every step of the way. And that's where, having that practice of the first question in isolation, and then the following up protocols are really, really key. So in terms of what is known to help, research shows that direct questioning by trained health professionals leads to a greater disclosure of domestic violence. And we do also know from research that women are more likely actually to report to a health professional. The majority will never talk to the Gardaí. We know that the majority even may not talk to a specialist service for a lot of different reasons, mainly that they may not even know that they exist, but also they may not think that this service is for them. So health professionals have an extraordinary opportunity. They're a trusted, highly trusted group of professionals, and the research shows that you're really well placed to actually elicit that disclosure. The routine inquiry, that universal question, does produce higher rates of disclosure, and sometimes there's a concern that people might be offended by it, but actually it showed that it's actually accepted by the vast majority when carried out in a confidential and safe environment. So obviously not asking somebody in a public space or with the door open, or just that they feel that the question is asked in an environment where the answer is wanted, is actually something that women would say to us. So the other thing is that evidence also suggests not just asking the once with that follow-up question, but asking at several points during pregnancy. It's that thing, I'll say it a little bit later on, around keeping the door open always. But actually, if there's explicit moments, that's built into practice, that further increases identification rates. So that creation of multiple opportunities for disclosure at all stages in pregnancy and postpartum, in fact, are some of the things that really work well. There's another piece of research here, and it's quite a recent one, it's 2018, and so it's around factors associated with the disclosure of domestic violence and subsequent positive service utilisation during and after pregnancy in Ireland. So that's a bit of a mouthful. I highlight this here because it's about acknowledging that it's not just your individual practice that matters here, it's also the systems in which we operate, the circumstances, the environments that we are forced to work in. If they are pressured work environments, if you are short of staff, if you are short of time, if the building itself is old and doesn't have, nice safe spaces, or even just discrete spaces. So the operating environment is really influences this as well. So I don't say this to make anybody feel that their practice is not good, but it's more about flagging that this can be the reality. And if we know that this is the reality and we know that that has a negative impact, then it's around, if you can see the problem, you can solve the problem, I suppose. So so what women do report is around, if there isn't continuity between the different professionals that women are engaged with, the opportunities for building up trust, or even just that continuity of knowledge and familiarity with somebody are obviously reduced. Time pressured medical appointments. I mean, now more than ever, we know that that's the case. And also because it's that thing of getting in and out just to stay safe and healthy. But they all are inhibiting factors. So I don't want to dwell on this, but I just think it's important that, we can do what we can do, but also it's sometimes about challenging the system to say, well, actually, if this is what we have to do, there's a consequence here as well for particularly vulnerable people. So the taking disclosures, this is one of the key things. This is not just for midwives or for, this is for everybody. This is for if it's your next door neighbour. This is for ourselves in our practice in women's aid, knowing the signs, listening. Oh my gosh, sorry. I don't think you can see me, but my cat just stood on the keyboard, so apologies. Knowing the signs, so that's just being aware and in some cases having training. Listen, be non-judgmental, and that includes not to judge the abusive partner as well, which seems like a strange thing to say, but being completely neutral and not judgmental and just listening is the best approach, certainly in the first instance. So communicating belief, really strongly validating the decision to disclose is absolutely critical. We did an independent survey last year, and it had a very robust sample of nearly 1,000 valid responses, all of women. It was overwhelmingly women who had experienced abuse. And they were 1/3 of that sample had never spoken to anybody ever about the abuse. And when asked the reason why, what the inhibitor was, the number 2 reason was fear of the perpetrator. We can all understand that. Number 1 reason was fear of people knowing what was going on. So effectively the stigma, there was internalized shame, but also it is important to acknowledge that a very key tactic of domestic violence is for the abuser to minimize what's going on. So to say, well, no, you're mad, it wasn't that bad. But also to blame her for the abuse. And so women think I'm going crazy, but they also think it's my fault. They also think I won't be believed. So first and foremost, creating that communicating belief, being non-judgmental and validating the decision to disclose. You did the right thing telling me. Those are all incredibly important if we're going to go overcome that stigma that is really clearly out there. Emphasize the unacceptability of abuse, name it as a crime, depending on what has been disclosed, and obviously using your own judgment as to how that might be received. And then support through encouraging ways to safely document incidents, offer support and referrals for safety planning, and that thing of always keep the door open. So either come back yourself again another time, but always say, look, you may not want to do anything now, or you may not want to talk about this now, but these are the circumstances in which you can come back to me on this, or I may come back to you, depending on your actual capacity to do so, of course. So where are we going with this? I think, again, mentioning that we have practice, we have our own personal practice, but it's also really important that the structures we operate in are, embedded with a conscious willingness to commit to responding to victims of domestic violence. So that would be perhaps creating domestic abuse policies, not necessarily just for client practice or patient practice, but also to have an employer policy. Women's Aid's worked with a number of companies, and indeed we have our own policy for staff. For example, we're a women's organisation, so statistically speaking, we will have people who may at some time experience abuse themselves. How do we respond? Do we have a policy? And does everybody know that policy is there? Communicates a willingness and a trust to engage on this issue. Overwhelmingly, midwives, nurses are women. So, are there policies there to support you? Because if you are supported and your colleagues are supported, then you're better placed to then also support a patient who might be coming in, who may be also experiencing abuse. Embedding training. I'll say a little bit more about that in a minute.
Sarah, sorry, it's Karen Murray here.
Yeah.
I'm terribly sorry to interrupt. No, this is your 2-minute call. Terribly. Yes, sorry about that.
I only have a couple left.
Are there any final messages that you would like to just put across to the audience before we finish up?
Yeah, I will. Thank you so much. Okay, so I really want to pop this one up because I know you're going to be talking about it later on, but it's so critical that you mind yourselves in order to mind others. I do want to say that these are our referral pathways, and there's contact numbers for ourselves and others. But also very critically, we are in a lucky position through some fundraising that's been done this year that we do propose to launch a dedicated 3-year project to try and develop an embedded collaborative training model with the maternity services in Ireland over the next number of years to reinforce and embed something that we hope we will have the partnership of the maternity hospitals in doing, and we hope that we'll be collaborating with you on as well. It's something we're very excited, which you're the first to hear about it because we only just got the board to approve going ahead with it. But that's where I think, we really need people stepping up, and we hope that we'll be able to be a part of that to resource you and for you to educate us as well on how we can work together to end domestic abuse. So I'm sorry I ran on there, but I'll stop.
You're all right,
so
Sarah. Yeah. Thank you very much. Yeah. That was a really, really insightful and helpful presentation, Sarah, and I know the audience will you know, a lot of what you've said will resonate with them. So thank you very much for that, and thank you for the resources. Just to highlight to the audience, there are other resources in the app. So if you look at the section where you've gone into the video here, you will see there are web links both for resources in the Republic of Ireland, but also a link to NI.gov for resources for Northern Ireland as well. So, you know, I'd just encourage anybody to have a look at those if they feel either they need them for themselves or for and anybody that they know. Just to say that we're moving into a lunch break now. Thank you very much, everybody, for tolerating us this morning. I would really encourage you all to take a break now from your screens. You know, it's been a pretty full-on morning, so take a break from your screens, but please do remember that the poster book is there. Have a look and do vote for your favourite poster. The afternoon session will start at 1 p.m. So we really look forward to seeing you again at that point. Thank you again, Sarah, for your time and for the presentation, and everybody else have a lovely lunch.